Hello there. Let's quickly discuss a little bit about Marfan Syndrome. It's a genetic disorder and it's a connective tissue disorder that I have been seeing in the clinics. I saw actually about 2 or 3 patients, and all of them were very tall. So, usually, the patients present with very, very tall heights, long tapering fingers, extremities, long toes. And most of the times, because it's a connective tissue disorder, their heart is involved, blood vessels. Connective tissue disorder also involved some bones and skeleton, and also the eyes. So let's start off with the eyes. A lot of times the patients are going to present with dislocated lens, which is also known as subluxation of the lens, where the lens is not in its normal position in the eye. And in this situation, in pretty much all the patients, I did see subluxation of the lens, which means dislocated lens. Okay, so it's not in its right position. For the dislocated lens, there are 2 options. Either we can put it back in its place, or we can take out the lens, and that condition is known as aphakia, which means the lens is no more there, and then we have to give them glasses, and their prescription may be strong plus powers eventually, and a lot of times patients are okay with that. So that was one condition that I saw related to the eyes with the Marfan syndrome. It's a genetic disorder. The other thing that you can see in the eyes is maybe retinal detachment, because they are really high myopes, which means that their minus powers are really, really high. Therefore, they're more prone to retinal detachments. They can present with retinal breaks, holes, tears, and we have to monitor them for that. Another thing that we notice in them could be early cataracts or early glaucoma also. So those are the things that are related to the eyes. And then for the heart, it's very important to have them see a cardiologist, because they can have high blood pressure, so you can have hypertension, which should be monitored by the cardiologist, and they should be treated for that early on. They can also a lot of times have the complication, which is known as dissecting aortic aneurysm, in which they can even die from that, because it's a very, very lethal condition. Aortic aneurysm is basically the aorta that comes from the heart. It could have the aneurysm, which is the pouching, or it could have dissection, which means that blood is seeping into the layers of the aorta. So they need a cardiology consult for that. And a lot of times they do have a cardiologist. If they have been diagnosed with Marfan syndrome, their primary care doctors, do send them to the cardiologist. The other things that they can present with, and that they need to be monitored for, are the skeletal abnormalities. So they can have scoliosis, which is curved spinal cord or curved spine or curved vertebrae. They can present with that, and they need to be monitored for that as well. And then I was reading, they can also have high arched palate, which is in the mouth, the upper part of the mouth, the roof of the mouth. They could have an arched palate, or they can also have flat feet. The arch of the feet is not very arched, it could be flat. So we, again, need to monitor them for that as well. So that was about Marfan syndrome. Talk to you guys later. Bye.